Can cognitive behavioral therapy delivered by telehealth reduce chronic pain? Do healthcare providers have an ethical obligation to inform patients about the use of AI tools in their care? What does outpatient care after firearm injury look like? This and more on today's Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, July 25th, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. JAMA published a randomized clinical trial this week about remote behavioral interventions for high-impact chronic pain. Dr. DeBar and colleagues focus on cognitive behavioral therapy, or CBT, interventions, a widely accepted and non-pharmacologic treatment for chronic pain. They randomly assigned patients to one of three groups: to receive CBT interventions from a health coach, to receive CBT through a self-completed online program, or to receive usual care plus a resource guide. The primary outcome for the study was a difference in pain severity score on the 11-item brief pain inventory short form from baseline to 3 months. The researchers found that both interventions, health coach-led and self-led, resulted in significantly more participants achieving at least a 30% improvement in pain severity.
Well, that certainly seems to be a substantial benefit. I think it's also notable that the authors report that this benefit was sustained at the 12-month follow-up.
There was also a very interesting opinion piece in JAMA this week. It's a perspective article about informing patients on the use of AI tools. Professor Mello and colleagues propose an ethical framework that could help clinicians and hospital systems decide whether consent, notification, or neither should accompany certain AI use cases.
For clinical reviews in education this week, Drs. Caruso, Kleiby, and Waroha have a review of ovarian cancer, a disease without effective screening and which often presents in advanced stages. Their summary includes essential information about the epidemiology, staging, and treatment of this disease. The accompanying JAMA Clinical Reviews podcast with authors Kleiby and Waroha provides additional discussion of ovarian cancer presentation relevant to physicians in clinical practice. Let's listen to a bit of their conversation.
We see a patient, abdominal bloating, constipation, some abdominal symptoms, vague symptoms that are lasting for a while, maybe some weight loss. So we're starting to think maybe ovarian cancer, maybe something else, we're not quite sure. What would a diagnostic workup include? You mentioned pelvic ultrasound. Certainly if we feel something on exam, we might start there. What would you say we should be looking for?
Taking that family history at that point would be useful, just to make sure. I think broadly looking at causes of abdominal pain, and that might include, if you're going to get an ultrasound, I think most people would also probably send off a CA-125 and a CEA value. Make sure people are up to date on age-appropriate cancer screening to help rule in or rule out the possibility of something like colon malignancy as well. Pelvic exam is actually still useful. It's probably not very sensitive for picking up a very early ovarian cancer. But for a patient who has intra-abdominal spread, which is how most patients do present, a pelvic exam, if somebody's experienced at it, can be quite useful, and a good abdominal exam also to look for ascites or omental disease.
And there's a review article on diverticulitis this week by Dr. Brown and colleagues. They discuss diverticulosis, uncomplicated diverticulitis, and complicated diverticulitis in this comprehensive summary. Examples of diagnostic CT scan images are also provided, along with a related podcast. Tune in to a second JAMA Clinical Reviews podcast this week to hear co-author Dr. Anthony Charles, who is also a JAMA Associate Editor, and JAMA Deputy Editor Dr. Mary McDermott discuss diverticulitis further. Here's a bit of that conversation.
Yeah, I think one of the greatest drivers of colon surgery now is acute diverticulitis. The prevalence of diverticulitis is increasing, particularly in those less than the age of 50. The disease is more aggressive. You have a high incidence of complicated disease. And we're seeing diverticular disease in younger and younger folks now.
Dr. Strong and colleagues wrote a JAMA Insights about caring for patients with a history of firearm injury. They provide a unique focus on ongoing care in the outpatient setting, like how to address physical limitations, PTSD, as well as potential lead toxicity from retained bullets.
The JAMA patient page this week is about prostate cancer, a common malignancy in men. In addition to information about symptoms and screening, it also includes helpful facts about localized and advanced stage prostate cancer.
Don't miss this week's JAMA Plus AI podcast, featuring JAMA Plus AI Editor-in-Chief, Dr. Perlis, interviewing Dr. Lindsay, who recently published an article in JAMA Dermatology on cost-effectiveness of digital technologies for melanoma detection. Together, they weigh in on whether AI can improve the cost-effectiveness of 3D total body photography used to identify melanoma lesions. Here's a bit of their conversation.
What is 3D total body photography and sequential digital dermoscopy, and what's sort of the standard application in melanoma screening?
So 3D total body photography, in this instance, in the study that we looked at, was done using the Vectra system, which basically takes 92 cameras and takes simultaneous images, which allows the creation of a 3D avatar of pretty much the entire skin surface. So that's your 3D total body photography. And what that allows is for the identification of lesions using computer software, because all those images get uploaded. And so in terms of the sequential digital dermoscopy imaging, so that is basically just dermoscopy, but done over time to identify changes in lesions, which help to guide the decisions for clinicians around whether it should be excised, left alone, whether it's benign, melanoma.
And don't forget, you can always find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jammamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.